This program is rated PG. It contains themes and scenes which may not be suitable for very young audiences. Parental guidance is advised.
Good morning, Philippines. Good morning, world. This is the MedTeach channel. I am your anchorman, Emocling, at your service. For the headlines, Inguinal hernia, more common to men. Measures on how to prevent inguinal hernia revealed. Let us now check the awareness of the residents of Baguio City and the students of St. Louis University about inguinal hernia. Dr. Ulysses Cuarte talks about inguinal hernia. Inguinal hernia, more common to men. Let us now have Erick Guiner for the news report. Erick.
Thank you, Nino. About 25% of males and 2% of females develop inguinal hernias. This is the most common hernia in males and females. Data from developing countries is limited, hence, the exact prevalence and incidence is not known. Gender and anatomic distribution of hernias is believed to be similar to developed countries. Generally, most of the hernias occur in the groin of the adults.
Approximately 75% of all hernias occur in the groin. 2/3 of these hernias are indirect or 1/3 direct. Indirect inguinal hernias are the most common hernias in both men and women. A right-sided predominance exists. Approximately 90% of all inguinal hernia occur in males. Indirect hernias usually present during the first year of life, but they may not appear until middle or old age. Direct hernias occur in older patients as a result of relaxation of abdominal walls, musculature, and thinning of the fascia.
This is Erick Guiner reporting from MedTeach channel. Back to you, Nino.
Let us now check the awareness of some residents of Baguio City and some students of St. Louis University with regards to their awareness about inguinal hernia. Live from Burnham Park is our news correspondent, Marc Hermes. Marc?
Thank you, Nino. I'm here at the Burnham Park to interview some people about their awareness about inguinal hernia and what are the possible causes of this disease. Do you know about inguinal hernia?
What's that? We don't have any idea. We're not aware.
Alam niyo po ba yung sakit na luslos? Alam niyo po ba yung sakit na luslos? So, saan po, anong kasaraan po yung mas parang mas nagkakaluslos? Babae po o lalaki?
Lalaki at ang alam ko kasi sila nagbubuhat ng mabigat kasi ng lalaki. Ito yung sabi nila, may luslos. Kailan huwag masyadong magbuhat ng mabigat. So, ang mga lalaki na bigat ang trabaho, sila mas pagka-gusto.
1, 2, 3. Kuya, alam mo ba yung inguinal hernia?
Oo, hernia. Hernia.
Ano po yung other term ng hernia?
Luslos.
So, ano po ang nangyayari sa luslos?
Ang alam ko lang yung nagsasag yung balls na ang alam ko or yung yung veins luslos.
So, sino po nagkakaroon ng inguinal hernia?
Lalaki.
Bakit?
Kasi sila yung may balls.
Paano po mape-prevent ang inguinal hernia?
Hindi ko alam. Kasi ang alam ko is since birth ba yun? Nakukuha ba yun in sa pagtanda?
So, ano pong masasabi niyo sa mga may mga luslos?
Stay healthy. And this is Marc Hermes reporting for MedTeach channel. Back to you, Nino.
The MedTeach channel will be back after this commercial.
This can lead to a disaster.
At least 40 people have died and dozens more are missing as residents in Manila and many provinces in the northern Philippines are facing some of the worst flooding in decades. More than a month's worth of rain, nearly 17 inches in all, fell on metropolitan Manila in just 12 hours as tropical storm Quetzana slammed ashore.
Say yes to anti-littering.
Log on to www.antilittering.com.
And now we're back. Some curious students want to know more about inguinal hernia. Dr. Ulysses Cuarte, a surgeon from Pine City Doctors Hospital, will answer their questions. Watch this.
If one can get inguinal hernia from trying to lift heavy weights that take the breath away, magkakaluslus ba kapag sobrang umiire habang nagbabawas?
Straining, okay, during bowel movement. And the more accepted theory now is that it is congenital. You know? There is a potential space and chronic or long-standing exertion leading to increased intra-abdominal pressure is the factor that leads to eventual development of hernia. You know? So it goes without saying that there is a defect, and through it is the telescoping of the viscera or the internal organ, and that internal organ has to be enclosed in a sac, hernial sac. Okay, so straining during defecation could lead to hernia, of course, because during defecation we have to exert effort, and in effect we have an increased intra-abdominal pressure.
Quick question. Can weightlifting cause inguinal hernia?
Weightlifting connotes or would entail muscle contraction. So muscle contraction meaning we have to increase the tension of the abdominal wall and other muscles. So in effect, intra-abdominal pressure can be increased through weightlifting. You know, it's not really the weight, but it's more the exertion.
I wanna ask about this also. Just wondering, does that illness make men impotent?
Okay, impotent. By impotent, I would mean that it should be a sexual function. Okay, so sexual function could be in the form of erection and at the same time ejaculation. Rather, the erection is more of the parasympathetic thing because it is the blood rushing into the sinuses of the penis that leads to erection. It is not or it is far from being affected by hernia, since hernia is a more of a superficial especially inguinal hernia, is more of a superficial process. The most that hernia can affect sexuality is through its mere size, that it could impinge to the passages or the passage of sperms, you know? So which is more of fertility rather than impotence or potency. We talk of fertility, it can be affected by hernia by virtue of its size or secondary to the operation or the correction of the hernia. Because vas deferens is located in close proximity with the sac, inguinal hernial sac, and other vascular structures. Fertility is affected, or infertility could occur. No? But as far as potency is concerned, it's a different thing.
Tanong ko din, mga guys lang ba nagkakaroon ng hernia?
Okay, going back to the problem in hernias, which is the presence of a defect, and usually it's congenital. Okay, the spermatic cord, which is the structure in male, has its female counterpart, which is the round ligament. The female, the spermatic cord is where the hernial sac is usually located, because there is a potential defect caused by the descending testis during embryonic life. Because the spermatic cord or the round ligament is the female counterpart of the spermatic cord, it can also harbor the same congenital defect of the spermatic cord, which is the patent processus vaginalis. Processus vaginalis meaning the sac. So that the same defect found in the round ligament could provide passage for inguinal hernia, or the visceral organ through which it can telescope and develop into a hernia.
And now for the MedThS channel special report. Let us now have a trivia about what inguinal hernia is. To do the report, let us now call on Miss Deborah Angupa to do the chica. Take it away!
Thank you, Nino. We have talked about different fields about inguinal hernia, but what is it all about? Let's watch this.
The tunica vaginalis is derived from the peritoneum. This is the development and scheme of the inguinal canal. From the dartos muscle, skin, the tunica vaginalis, the internal spermatic fascia, and inguinal ring, the cremasteric muscle, the superficial inguinal ring, and external spermatic fascia. The deep inguinal ring is lateral to the inferior epigastric artery, where indirect inguinal hernias pass through this ring, while on the other hand, direct inguinal hernias bulge directly through the abdominal wall medial to the inferior epigastric artery.
Although there is no way to prevent hernia due to a congenital weakness or family history, one can help reduce the risk of developing an inguinal hernia or prevent a hernia from recurring by following these simple guidelines. If you are overweight, follow your physician's advice for losing weight. Being overweight creates greater abdominal pressure and increases the risk of developing an inguinal hernia. Maintain a healthy weight through diet and exercise. Oh! Avoid rapid weight loss such as in crash dieting. Rapid weight loss programs may be lacking in protein and vitamins that are needed for muscle strength, causing weakness in the muscles of the abdomen. It's so hard. Oh! Avoid lifting, pulling and pushing heavy objects. Use proper lifting, pulling and pushing techniques when needed. You bend at your knees and lift using your legs rather than your back. Oh, use deep breathing technique to help control coughing. Obtain a medical prescription to treat the condition causing cough. Avoid constipation and straining during bowel movements and urination. Increased abdominal pressure will lead to inguinal hernia. Oh, eat foods that are high in fiber and drink plenty of fluids. Using stool softeners or natural stimulant beverages such as juices may be of help. And also, stop smoking, because coughing from extreme smoking can develop inguinal hernia. And also, smoking is bad for the heart too.
Again, this is your anchorman, Nino Emocling, for the MedThS channel, where the truth shall be proclaimed, where the knowledge shall be enriched, and where fairness shall prevail.